a second and introduce yourself for everybody that's watching this video?
I can. My name is Lauren Casey Smith. My full country name.
Nice. Okay, where are you from?
Originally from Texas, born and raised, which is why I said my middle name was Casey.
Is it Casey with a K or?
No, Casey.
Okay,
Lauren
perfect.
Casey Smith. Yep. No, so originally from Texas, kind of all over, but mostly the Dallas area. So I apologize if I throw in a few y'alls into this conversation.
I was gonna say you don't really have an accent. Is that because of traveling and being in different places, or?
I think it's a little bit of that, and also, so I grew up in the country and I had a really thick accent, and then me and my family moved to the suburbs of Dallas, and then very quickly realized that we didn't fit in, and so I think
Stuck out
like Darwinian
Yeah.
methods, we eventually all, our accents subsided, but if I hang out with some really Texas folk, it will start coming out.
Comes out.
Yeah.
So speaking of traveling, did you go to different schools in different places, or were you a Texas girl from start to finish as far as vet school and post-grad work? Or
Yes and no.
Where were you?
Yeah. So I went to, so I grew up out kind of in the Dallas area. Actually went to Plano East High School, which is actually the biggest high school in Texas.
Yeah. Big football school, right?
Yeah, big football school, like truly Friday Night Lights through and through.
That's it.
Yeah. So is a pretty cool area to grow up in. And then I went to the University of Texas at Austin. Go Horns. For undergrad, I got a Bachelor of Science in Nutritional Sciences, as well as completing my pre-vet coursework, kind of leading towards veterinary school. Then went to Texas A&M, which the two are big rivals, or at least they used to be. So I went to Texas A&M for vet school, and was there for 4 years. Graduated in 2013, and then kind of bounced around the country for my internship and residency training to become an oncologist.
Where did you do your internship?
Yeah, so I did my internship in Tucson, Arizona. It's I really actually enjoyed the life of Arizona. Having the really curly hair I do, any humidity was just not going to work, and so it definitely helped tame my fro a little bit. So basically I actually when I was very first introduced to radiation oncology, it was between my first and second year of veterinary school. I knew at that point that I had worked as a vet tech in a general practitioner's office and fell in love with veterinary medicine, fell in love with working with dogs and cats and their clients, and kind of really loved taking care of the dogs' day-to-day life care. But I also knew intellectually and kind of that I wanted to go a little bit beyond that, and wanted to kind of further specialize. And so between my first and second year of vet school,
Sorry about that.
Oh, you're fine.
Part of all interviews.
Oh yeah, all of them.
Yeah.
So between my first and second year of vet school, I actually worked for Gulf Coast Veterinary Specialist, which is a huge specialty practice in Houston, Texas. I actually worked as a rotating, kind of visiting summer vet student / technician there, since I had technician experience. And so I spent 70% of my time working as an ICU technician. And so taking care of all the critical patients, taking their vitals, doing different procedures for them. Yeah, so I really enjoyed my time there, working as a rotating kind of summer intern, so to speak. And as part of that, because I was interested in specialty, they let me rotate through different specialists and kind of get a little taste of each specialty. So I got to rotate through dermatology, cardiology, surgery, radiology, and then ultimately ended up spending 2 weeks in radiation oncology and just immediately fell in love with it. And that was as a first-year veterinary student, which I don't think anyone else would probably say that with it. And made some good contacts at Gulf Coast, and from there kind of got more and more interested, got more and more experience in radiation oncology, kept in touch with them, got really involved in the Rad-Onc program at Texas A&M, where I was a vet student, and ultimately made some contacts with a really big radiation oncologist in the veterinary industry, and her name's Mary Kay Klein. And so she's one of the top radiation oncologists, and one of my really good friend and mentor of mine at this point. And so I ended up doing like a month externship with her during my 4th year of veterinary school, and just really became good friends with all of her technicians, and really enjoyed kind of working alongside with her, and really learned a lot from her. So I ended up doing my full 1-year internship with her at her hospital out there, which was a really great experience. And
that's in Arizona. Okay.
And that's where it's in Arizona. And the nice thing was that she kind of created this internship for me where it was a rotating internship, so I got experience with medicine, surgery, as well as a lot of ER. But then I also got to spend a significant amount of time with her doing oncology and kind of working on research projects, and really setting me up for success as an oncologist. So.
Awesome. And then after that, you went to Wisconsin, right?
Yep, and then after that I had my 2-year residency program at the University of Wisconsin-Madison, which was a fantastic program, and have a lot of really great friends and colleagues out there that I miss a lot, but I got to train alongside some of the top medical physicists in the industry. So the leading physicists in the industry are out there, and I got to go to a lot of meetings and presentations with them. I got to do some graduate coursework where I learned a lot about physics, more than I ever wanted to know, as well as got to train under some really great veterinary radiation oncologists in the clinic, and got a lot of really great experience there.
So you said it was a 2-year program? Is that normal? Because most residencies are 3, right?
Yeah, so basically my program, it's now a 3-year program, based on some recommendations, So basically we had many weeks on the clinical floor. I didn't really have any off-clinics week to focus on research, and so any time I put into research was kind of after hours.
So it was just consolidated. Okay.
Yeah.
Okay, so for the next part of this interview, we're going to do rapid fire questions regarding dog breeds. Okay?
Oh no! How did you know this is like my least knowledgeable topic?
Well, this is going to be a lot of fun.
Oh geez, alright.
I tried to keep it positive so that we don't hurt anybody's feelings. First question, and absolute first breed that comes to mind. Ready? We're going to cruise through these quickly.
I'm on it.
Number 1, goofiest.
Great Dane.
2, most intelligent.
Australian Shepherd.
3, happiest.
Goldens.
4, most athletic.
That's a tough one. Terriers.
I like that. 5, most loyal.
I'm gonna again go with the Shepherd. Probably Border Collie.
Okay.
Yeah.
Okay. 6, hardest to train.
A Fletcher dog.
Whatever Fletcher
That's my dog.
is. 7, strongest.
Pitbull.
8, best large breed.
Newfoundland.
9, best small breed.
I'm gonna go with it's a tough one. I actually really like Shih Tzus. That's like a closet fact knowledge about me.
I'm quiet because I'm laughing. I would never have pictured that.
I know.
That's amazing. And number 10, dog versus cat.
I like cats.
You
actually.
do?
Yeah.
Okay.
Yeah.
We're learning all sorts of
I know.
stuff here today. Okay, service. Tell us a little bit about radiation therapy.
So, the very first step in this whole process is, I want to meet the patient, I want to meet the client, I want to talk about, what are specific treatments for your pet. This is all about patient-focused treatment. This isn't, I'm not just treating a particular tumor type, I'm not just treating a particular species, every patient, we have to consider the entire patient, everything else going on with him or her, to make sure that we're picking the best treatment option possible, but then also laying out multiple treatment options for clients to make sure that they're comfortable with what they're deciding on too. And so most of the time, for most cases, the next step is going to be to get a really high quality CT scan. We get a couple different pieces of information. One is that usually we're getting, just like you said, a lot of information about how invasive is this tumor, or has this tumor metastasized or spread, and all of that information can give us, give us the best information to make the decisions to move forward as far as treatment goes. But also, it's the kind of the first step in the radiation treatment process. And so even though the CT scan gives us a bulk of information for kind of prognosis and treatment options and everything along those lines, also what we're actually going to do is put the patient in the exact position we want to treat them in, so that I can make the radiation treatment plan based on that CT scan. And so what actually ends up happening, so say a patient is going to move forward with radiation treatment, then the first step is going to be, I actually pull it up on my computer, and like a little kindergartner, I literally take a mouse and I draw out where the tumor is, slice by slice. I draw where their eyes are, I draw where the brain is, or if it's, in another body part, I draw where their liver is or where their heart is. And I literally do that on millimeter slices, slice by slice. And what that allows me to do is to figure out how I can put the radiation in to treat just around the tumor. Usually there's some sort of margin around that, but how I can kind of physically spare everything else around it to make sure, again, that I can treat the tumor while sparing normal tissues. And so really the CT scans that we get every single day are to make sure that the patient's in the exact same position to improve our accuracy. And then as far as kind of recheck CT scans beyond that, they're usually a little bit more delayed end time points.
Okay.
Yeah, so I was telling Courtney earlier that no one has ever asked me that question before as far as like what is my day-to-day of what I do, and I think it's actually, I personally think what I do is really cool, but I think it'd be really interesting for people to hear about kind of all the little ins and outs of what I do every day, because it's a really good mixture of things. I'm sure most people already kind of envision vets, seeing appointments or potentially doing surgeries, and then maybe doing some paperwork and phone calls. That's probably like a day-to-day of what most veterinarians would do. And for me, it's a little bit of that, but then a lot more. And so I would say I see, patients, new patients, and new clients for consultations, where I review kind of what potential cancer they've been diagnosed with and what potential treatment options they are. That includes radiation, among many other treatment options that are available to them. I see patients that have already come to see me and have been treated, and I see them for rechecks throughout the day. I'm making a lot of phone calls throughout the day, but then probably one of the cooler parts of my job is that I'm actually sitting down and doing radiation plans themselves.
Like that, but radiation oncology is pretty specialized. There are only how many in the country?
So I just recently went to our college meeting, so the American College of Veterinary Radiology, and I thought there was about 100 of us. Turns out it's less than that. So there's, I think, around 80 practicing veterinary radiation oncologists. So.
And how many residents at any given time?
Usually anywhere between 15 to 20.
Okay.
So our numbers have been slowly growing. I think what drew me to radiation oncology is that I really enjoy imaging, but I also know that I'm very much a people person and could never just sit behind a computer screen all day and particularly read out, radiographs and CT scans and MRIs. And one of the things I really enjoyed about being a technician in GP or during kind of my veterinary school training was actually getting to know clients. Like I absolutely love talking with clients, and I love working directly with patients. And so one of the nice things about radiation oncology is that not only do I get to be a part of these CT scans and some really, really cool technology, but then I also get to spend a lot of time with these patients and a lot of times with these clients. And one of probably my favorite part about my job is, these aren't any dogs or cats. These are dogs and cats that have been a part of the family for 10, 15, sometimes upwards of 20 years. And they're not, beyond them just being really loved, they're usually
Strong
these are the heart dogs of the family. These are the cats that, I absolutely love cats, and I love cats for what they are, but I've never in radiation oncology had to work with a fractious cat, so to speak. And part of that's probably because I'm just very tolerant and yeah, I'm very much a cat person, but also it's just because I get to work with the best patients and the best clients in the world, and these are, I get to offer them options for pain relief and potentially, more long-term tumor control, but these are some pretty remarkable dogs and cats that I get to work with. I've gotten to treat a bomb sniffing dog that saved a whole cruise ship of like a whole like boat full of 100 people. I've gotten to work with a lot of therapy dogs that have done a lot of work, even most recently a search and rescue dog who's done a lot of work here locally, saving some elderly people. These are a lot of remarkable dogs and cats that I get to work with, and their clients along with them are also pretty incredible. So
That's awesome. In that same vein, so a lot of times when speaking about cancer treatments for pets, people may think that radiation is too hard for their pet, or they don't want to put them through radiation and or chemotherapy. How would you address that concern?
yeah, I think the hardest part about this whole thing is everyone has a previous experience of story when it comes to cancer and or radiation and chemotherapy, and there are always, those really tough stories, or it's always with something very personal, and it's hard to separate that. And what I usually talk about with my clients is that for dogs and cats, it's completely different. My primary goal for every single one of my patients is their quality of life. If I ever for 1 second think that radiation is going to be against their quality of life, I'm going to be the first person to tell them that. I'm going to let them know, I don't think that this is in your pet's best interest. I think we should seek out alternatives. That's usually not the case, and that's again because my goal is they're going to be their quality of life. And so compared to like radiation and chemotherapy in human medicine, when I work with dogs and cats, I don't get that luxury of being able to explain to my patient, oh, you're going to have to go through X, Y, and Z for potentially these side effects for, so many days of an outcome. I don't get that luxury. And so all of my our radiation protocols and our entire scheme of what we're trying to do is all geared around making sure that their quality of life improves, and ultimately prolongs. And so the way to think about it is I'm not trying to get, X number of days. I'm trying to get more good days. I don't ever want any more bad days for my patients. And so, the radiation doses themselves are much reduced compared to human medicine. The same goes usually with chemotherapy, because instead of, trying to really push our patients for a cure, instead we're trying to walk this tightrope of, okay, well, I want to kill as much cancer as possible while my patients still feel as good as possible. Yeah. And that's our entire goal through this entire thing.
What does radiation actually do? Does it just deliver radiation to cells? And what does that mean?
I think of how to word this. So radiation itself is going to be a local form of cancer treatment, so similar to surgery. And so how is it going to affect the body as a whole is that the long and short of it is that it shouldn't. And so radiation should really only affect exactly where we're aiming the beam to just around the tumor. And so a lot of times just around the treatment time, that area can become a little bit inflamed. And then long term, there might be some scar tissue that forms. And depending on truly the tumor type and the area we're treating, depends on the intensity and severity of those side effects. But again, in general, our hope is to reduce those side effects to as minimal as possible, to make sure that pets maintain a good quality of life. I think the easiest comparison between dogs and their human counterparts and how they tolerate radiation is there's reports of humans after we receive radiation to our brains, our one brain, not our brains.
Multiple brains.
Some of us have multiple.
Brain,
yeah. So after, if a human receives radiation to their brain, there's what's called somnolescent syndrome, where we're just a little bit out of it. Maybe our vision changes a little bit. Maybe we can't read the fine news, the fine print on the newspaper. And so there's all kinds of reports on that after brain irradiation in humans. But if I'm talking about a Labrador Retriever, he might fetch the newspaper, but does he have to read the fine print? No. Right. And is it going to matter if he sleeps or takes a nap, an extra hour a day? No. In general, that's not going to affect his overall quality of life. And so, there's some things that we may never know the answers to for pets because there's only so much information we can get from them. But as far as we can tell from a clinical standpoint, and as far as from the clients perceiving their quality of life, there's research paper after research paper showing that we believe that they tolerate it really well.
So do you have any thoughts about money? I mean, sadly it boils down a lot of times to cost and time and people taking off of work and all that good stuff.
Yeah, I think I tell at least one client every day that what I offer for a lot of my patients for radiation therapy, one, my schedule couldn't allow for, and two, like, I don't even know if I'm financially in a position to afford, and so certainly it's one of those things that can have a lot of benefits for some patients, but money, unfortunately in the veterinary world, is always the center of these conversations. And I think that's okay. I think it's just important to talk about it and to be aware of that. I think from my standpoint, considering the quality of medicine and the quality of radiation therapy that I'm delivering, our costs compared to human medicine are usually significantly reduced, and a lot of that's because I'm doing a lot of the multiple steps that require multiple people kind of behind the scenes in the human world. But it is still significantly expensive, and so depending on the type of radiation treatment that we're talking about anywhere from around like $3,000 to $4,000. If this is kind of we're going for a couple treatments for some palliation, to upwards of even like $7,000 to $10,000 if we're going for more of a definitive long-term tumor control or a cure.
Yeah.
I 100% agree with you that early detection is usually the best, because that usually allows for kind of some more geared treatment towards them. And so typically for some tumor types, we're talking about surgery and a CT scan and radiation, or sometimes we can just do radiation. And so it's definitely dependent on tumor type and location for sure, but I would agree that, early tumor detection, which obviously the big thing here, I'm not a general practitioner anymore, but, the best thing for your pet through and through is going to be routine physical exams. Like having someone really do a thorough physical exam on your dog every 6 months, as well as you petting your dog and getting checked out for any new lumps or bumps. That's what's going to really help these situations. But yeah, certainly radiation itself is unfortunately expensive. So there's a couple different ways that we can kind of approach that. As you mentioned earlier, so we both work for a nonprofit group called Fetch a Cure. They are a fantastic organization, including they have a Companions in Crisis program that can help provide financial assistance for pets' cancer treatment for those in financial need. So all it takes is a phone call and application. And I have a fair number of patients and clients that have received help in that way and that otherwise couldn't receive treatment. So it's just fantastic to see those kinds of things happen. Probably one of the more incredible things I've seen come of that is the network of people they've also been able to leaning on.
Yeah.
So this is a lot to go through for my clients, and certainly I can sit here and talk all day with them about what they're going through, but everyone has a little bit of a different experience. And I think one of the great things about getting involved with organizations like that is just finding a network of people that have been through what you've been through that other people may or may not understand if they haven't been through it themselves. But there are a few other organizations out there depending on your kind of geographical location. And certainly depending on the area, there may be some clinical trials that are available that a lot of times provide financial assistance that can help. One of the big kind of components as veterinary radiation oncologists that we're really trying to utilize is going to be that dogs and cats, when they spontaneously form cancer, are going to be a really good model for potential cancer detection and treatment in humans. And so kind of utilizing a lot of the research for human cancer, utilizing those on our dogs and cats to make sure that we can not only progress the better cancer treatment in our dogs and cats, but as well as humans. That's huge, and utilizing the kind of funded research towards that for our own personal animals, but also to kind of push that research forward. And so a lot of times there should be clinical trials for that.
Okay. And how do people find those trials?
So If you look up the veterinary medical teaching hospital in the area, that's probably going to be the best place for them to look. There also are going to be, I don't know the websites off the top of my head, to be honest with you, but like I think probably the best place for you to look is to contact your local oncologist or the veterinary medical teaching hospital website.
How do you feel about insurance and this kind of conversation? Is it beneficial, or do you find that it's not as beneficial as you would hope, or is it?
Yeah, and so I guess my experience with insurance is a little bit limited, in that only so many of my patients and clients come in with it. From my perspective of things, which I'm not always on the money receiving end of things, it's usually the clients. But my perspective of things is it seems like the patients that do have insurance are able to kind of get through with their treatment a little bit easier because of that, and so cost isn't as much of a concern. To the point where my own dog personally has insurance, just because I know that if it came time, everything and anything would need to get done for her.
Right.
And that certainly has helped her when she's become sick and in times of need. But I think the way to think about it is just knowing that if you have a dog or cat, that unfortunately unforeseen health problems are going to occur, and to plan accordingly for that. I'm speaking to the choir, and I'm pointing to myself because I'm bad about this myself too, but whether it be insurance or putting money into a savings account, I think that's going to be the toughest thing is, unfortunately, a lot of this stuff does cost money, and being prepared for that to make sure that you can do what you want to do for your pet.
Why did you decide to become involved with Fetch a Cure? Was it a network of people, and is it, you obviously have been a huge part of the success of Fetch. What part of Fetch spoke to you and made you want to become a member or a participating doctor on the medical advisory board?
Yeah, so it was actually, it was really interesting. As soon as I met Joanne, who is the executive director of Fetch a Cure, as well as Rebecca Spivey, as soon as I met the two of them, I knew that it was people I wanted to work with, and somewhere I knew I wanted to work. They have their hearts in the right places, and one of the hardest parts about veterinary medicine is going to be the financial aspect of things. But also, again, having that network of people like we talked about, and knowing that there's people out there that not only have, one, recognized this problem, but two, put in all of this hard groundwork to do something about it and provide that network for this community is huge. And so I worked as we went through, I worked in a lot of different places, and I worked in a lot of veterinary practices, and everyone tries to dabble a little bit in kind of these things and providing emotional support for clients and potentially clinical trials to kind of help for those with financial need. I've never seen it done to the scale or as well as done as that Fetch a Cure has put together. And on top of it, they're just really great people. And the longer I've lived in Richmond, the more I've realized that it's a really great community as well, that it kind of makes sense why all of this has come together here.
Working with cancer patients and their owners must be incredibly challenging for you and emotionally exhausting. What's the hardest part of your job, and how do you stay balanced?
Yeah, and so I would say, my clients are, for me, definitely a double-edged sword, in that a lot of my clients are some of the favorite parts of my job. I've met some really interesting, really fantastic people. And most of the time they're coming for, they just want to seek guidance, and these dogs or cats are everything to them, and they really just want to do what's in their best interest, and ultimately providing them, some pain control or pain relief, and just making sure their quality of life is at their best is, a good experience, and I'm able to help them and achieve that. But it's an emotional roller coaster for them too, and I can completely understand that. And so, a lot of times this isn't, unfortunately, a curable situation. And sometimes we can help them for some periods, and then the tumor may come back, and then it's kind of a yo-yo effect, and that can be certainly taxing for clients. And they ultimately want to do its best, and that may mean calling us or emailing us multiple times a day, and that can be really, really challenging on my schedule as well, having many, many clients and many patients. And so I think as far as trying to provide kind of good balance is I think I try to make sure to focus on things that are going to be overall good for my health, because I need to be in good physical and mental shape for my patients and clients just as well as they need to be. And so having a nutrition degree, I certainly try to make sure I continue to eat a good diet, and certainly I try to be, I'm an athletic, very like outgoing, kind of stay active person. So even if that doesn't mean I make it to the gym or to yoga once a day, I try to go on a long walk with my dogs. And even if I don't get to make it to a music concert tonight, I'll listen probably to my favorite album. I have, my vinyl record player. It's just as well. So, just making sure that, I get a little bit of me time mixed in with everything else, and every medical professional needs that.
That same vein again, what are some other activities or groups that you're involved with outside of veterinary medicine? Because you are a human being that has other interests besides
I am a human
radiation
being.
oncology.
Yep. So I'm a little bit newer to Richmond, so kind of still kind of getting acquainted here. But kind of things I enjoy doing outside of kind of work, or I'm really big into live music. And so you will frequently find me at a concert venue, or potentially a music festival or something of that sort. I also really enjoy traveling, and so I have a lot of friends and family that I'll go and travel around to see. And then, as we've talked about, I have the world's most beautiful Australian Shepherd. Her name is Ruby, and she's perfect, and I spend a lot of time with her.
She's a model.
I also have a boyfriend, and he's pretty cool too, and another dog. But no one's as perfect as Ruby. Yeah.
Growing up, did you always know you wanted to be a vet, or was there another career that you had thought about trying to pursue, or is there any other field that you ever could see yourself in?
So growing up, I never thought I was going to be a veterinarian. I think I'm like the one
only person.
Yeah, I'm like
ever.
one of there's like 10,000 of us or something. I think growing up, I always planned on being my dad was a medical doctor, and I knew I was always good at math and science, and so that's kind of was my plan. I got my very own, I always had family pets, but I got my own very personal, first pet, when I was 16 years old. He was my heart dog for sure, and we went on many adventures together that led us to the veterinarian many times. And eventually I started college and was enrolling in courses and was like, I'm doing all this work to prepare for this, to be a medical doctor, but I really love animals, why haven't I put two and two together? And that's kind of when I started working as a veterinary technician to see if that's something I wanted to pursue.
What would the best client you could ever imagine be like?
Yeah, I think the best client is one that comes in with an open mind. And one that comes not necessarily well prepared, but they need to come ready to listen, to educate themselves, and be ready to ask questions. Because I think one of the most important things that you can do as a client is to make sure that you are as comfortable with the treatment outcomes and side effects just as much as I am. And so I think a lot of people still see veterinarians as, I say you must do X, so I must do X. And I very much practice in a manner where I offer options to clients, and I want to make sure that they're comfortable with them. And sometimes there's a very clear-cut answer of you should do X versus Y, but sometimes there's not. And so the clients that I enjoy the most are ones that I get to have a really good conversation with, that will ask questions, and we can kind of have a back and forth, and making sure that we can pick a reasonable option for their pets.
Do you think that Dr. Google is a difficulty for you, or are you happy if people have done some research? I know it's probably...
Yeah, it depends. I think it depends again on the client. I think if someone goes on Dr. Google and doesn't, needs to realize that you have to take some things with a grain of salt. And so if you read one sentence on some random website there, is that opinion is going to be more than my evidence-based medicine? No. But if you find a reputable website from a veterinary school or a published article that's peer-reviewed, like I have a lot of other scientific-minded people that do that, and that can potentially be useful. And so, but again, I encourage owners to become educated. I think the most important thing is, just like with everything else these days, the fake news thing, you have to make sure that you're reading reputable sources of your information and that understand that it may not be reputable. And so that's when it's important to ask those questions to your vet.
Okay. This next question is interesting. You've mentioned before that you had a very special dog in your life. Can you tell us about him?
Wait, him or her?
I don't know. Is it her?
Oh, my previous dog?
Yeah.
Oh, yeah. I can stop, definitely. So his official name was Joseph Blue Smith. Because at the time I was 16 years old, and my favorite movie was Old School. And it was like the Old Man Blue. Yeah, and so like from day one, I'd be like, "You're my boy, Blue," and he would get all wiggly, and it was the best. Yeah, he was one of those dogs that was life-changing, and for me, like, very specifically life-changing, and that, like, he is the reason I became a veterinarian. I had him from high school, through college, through veterinary school, through internship, through residency, and saying goodbye to him was probably one of the hardest things I'll ever have to go through in my life. Anyone that met this dog not only knew how special of a dog he was, but knew how attached the two of us were together. And, even I have acquaintances that I very rarely talk to, but it's one of those things where if they ever find an old picture of Blue Bear or see something pop up on Facebook, like, they're always going to reach out to me and comment. Yeah, just because he made such an impact on everyone around him.
What was he? What breed?
So he was a mutt. So most of my family lives like out in rural Texas. We have a Angus cattle ranch, and so my aunt and uncle had a shepherd mix that went missing, and they were worried that something happened to her being out in the country. Nope, turns out she
something
went out.
Did happen to her.
Something did. Multiple things happened to her, and so one night it was like storming on their farm, and it was pouring down rain really bad, and all of a sudden they saw something moving back and forth out in front of like their barn. And she had finally returned home, but they're like, "What is she doing?" And she had gone off to give birth to 13 puppies as like a big shepherd mix, really big puppies. And because it was raining, she had hid them under a trailer, and the water was rising, and so she was moving them to higher ground. And so that's when they knew, one, she's returned, but also two, she had puppies and started helping take care of them. And so at that point was like, well, I'm getting a puppy. This is happening.
Everyone gets a puppy.
Yeah, exactly. And so I picked him out. I got, I think, like first dibs or something, and I got to take a moment when he was like 6 weeks old. He was like this big and like a brown fluff ball. He kind of looked like a red Australian Shepherd.
Yeah.
Had this like really big, beautiful tail, but was definitely very much a shepherd, and he was very protective, very intelligent. Very athletic, yeah. And so his probably the smartest thing he could do, and most annoying day-to-day activity, was that he could open any doorknob, including unlocking and locking, like deadbolts. And so there was really no containing this dog whatsoever.
He just wanted to be with you.
Yeah, he would do like whatever he could to be with me. And so like if I like left for the day and it was storming, he would automatically like a switch would go off, and he would be like, "I must save Mom. She is in the storm. I don't know what's gonna happen to her." So every time it stormed, I would come home and the front door would be wide open, and he'd be sitting in the front yard waiting for me. He was, yeah.
A good egg.
He was.
And your current pups, you have Ruby Tubbs.
Ruby Tubbs. That's Tubbs with 2 B's.
Yeah.
She's extra tubby.
The extra B.
Yeah, so we threw in the extra B. Yeah.
And then Mr. Fletcher.
And Mr. Fletcher.
You decided to get from here in Richmond, right?
Yep, he is what is it, Richmondonian?
I don't
Is there a
know.
name for it?
Richmonder.
Richmonder. That sounds made up. All right.
Go with it.
Yeah, so Fletcher is a little mutt dog that I got from Richmond Animal League here in town for Ruby. And actually a pretty cool story just because, me, after I said goodbye to Blue Bear about a year and a half ago, Ruby was kind of the only dog, and it took, me and Ruby actually weren't that close when Blue Bear was around, and he was definitely alpha dog of the pack, and Ruby kind of did whatever he said, and then me and Blue Bear had a really close relationship, and it took me and Ruby probably 3 to 6 months to kind of figure each other out on our own. And eventually we became really close, and she's kind of blossomed into this really, really wonderful dog, and so me and her have kind of been on our lonesome for a while, and that really kind of melted my heart and realized, okay, it's time for us to get a second dog again, and that's when we got Mr. Fletcher.
And now you're a pack of 4.
And now we're a pack of 4.
Nice.
Yep.
You touched on this a little bit earlier, but do you have a hero within the veterinary profession, or if not in the veterinary profession, outside of veterinary medicine?
Yeah, that's a really good question. I really would say that my hero in the veterinary profession definitely would be my mentor in Arizona, Dr. Mary Kay Klein. I don't even think I appreciated that at the time until now I've been out here on my own practicing.
After the fact.
And I'm realizing just how much she did, not only for her patients, but also for the profession in general, and to kind of contribute moving stuff forward. And so she owned multiple practices in Arizona. She was double boarded in medical and radiation oncology, and she ran all of these practices on her own, as well as she saw about 20 cases a day, and ran an internship and residency. And on top of that, was involved with many organizations to offer multiple clinical trials for her clients, regionally as well, which both, again, benefits the patients and the clients as well as kind of furthering research. And so at the time I was impressed, but the further I get out, like yeah, it's a miracle.
Still practicing?
She is, and so she's still out in Tucson, Arizona, and I still keep in touch with her. So,
as an oncologist, is there anything you wish referring vets did or did better with relation to how they either refer patients to you or how they do things on their own without your help? Was there any pearl of wisdom that you might offer?
yeah, I think the most important thing is setting your clients' expectations up for, reality. So, telling clients, even if you don't know, if a veterinarian doesn't know much about, what the particular cancer is or what treatment options are available, just being honest with clients of what the diagnosis is. And I think it's okay, too, to say, I really don't know. I really would rather you go to an oncologist and speak to them about that. And that's something I'm more than happy to talk to them about. But, making sure they at least know that the pet has cancer, and making sure that they know the diagnosis is important before referral. And then also giving them expectations for what it's like to see a specialist. So, that it's going to be a more lengthy appointment for us to be able to sit down and have those conversations about what does this cancer diagnosis mean, what are potential staging tests, what are potential treatment options. And then also trying to give them kind of realistic ballpark as cost estimates. I have many clients that come and just want to hear information, and that is 100% okay. And sometimes they just need the information to be able to make an educated decision for themselves. But making sure that their clients at least have some ballpark of what things cost to make sure that they're using their time and their resources wisely.
Pet Cancer Awareness Month is in a couple days. What strides do you think that we've made with our pets, and what areas do you think that we could still improve upon?
We've made huge strides with our pets. There's probably 3 to 5 different cancer types that we still treat to this day, but that we're treating a lot differently because of early detection. And again, a lot of that is because of really good, thorough physical exams done by your veterinarians. And so that's really thorough exams of the oral cavity, checking for tumors in the oral cavity. Also doing routine rectal exams. Nobody enjoys doing them or receiving
Patient
them.
or doctor.
Yeah, but it's really important. And that's completely changed the way we treat anal sac tumors because we're catching them earlier and earlier, which is really great for the patients. Areas that I think we could still improve are going to be multimodal treatment modalities. And so even for me as a radiation oncologist, not only am I new to the Richmond area, but it's something that, because it's a newer treatment modality that's been growing a lot in the veterinary world, many veterinarians didn't have basic training in radiation and the basic knowledge enough to know what are good candidates for radiation and when they can refer for radiation. And know that it's even out there and available for their patients. And so I think that's something we can definitely improve upon, is making sure that everybody knows, there's a lot of different options besides surgery and chemo out there for your patients, with a lot of different goals in mind too. This isn't, this is all can be palliative too. And so making sure that we have a good understanding of what are available.
What do you think the future of cancer treatment and radiology looks like?
So I think that probably the future of cancer treatment right now, if we were to kind of read all of the articles, is there's a lot going into what's called immunotherapy, which is basically where we're kind of almost ramping up your own immune system to attack your own cancer. The benefits of that are going to be reducing side effects to treatments, and so instead of using like toxic chemicals or radiation, instead you're basically kind of boosting your own immune system to attack the cancer. And so I think that that's going to be a lot of huge kind of groundbreaking treatments in the coming years, 5 to 10 years. As far as radiation therapy, I think because of our advancements in our radiation accuracy delivery, we've been able to kind of minimize the number of treatments as well as minimize side effects associated with that. And so that allows us to treat more types of cancer and treat more patients. And we've already started seeing that, and with pretty spectacular results. And I think that will, as we gain more experience in that, we'll get more knowledge about it and be able to expand the ability of radiation treating many pets. So.
If you could tell pet owners one thing when they receive the cancer diagnosis for their pet, what would that be?
Take a second, take a deep breath. It's a lot to process, for sure. And the most important thing is, while you want to make timely decisions, you also want to make ones that, again, you're really comfortable with, and you want to make sure you're educated. And so while you want to make sure that you get treatment as soon as possible, you also want to make sure that you're really putting a lot of time into that, almost like the information gathering phase. That's hugely important, because you, as the client, you want to make sure that you have all of the information that you need as possible to make the best decision possible. And that might mean seeing your vet along with another specialist and along with an oncologist. It might mean seeing a medical oncologist and a radiation oncologist. Or it might mean, if you don't particularly jive well with one oncologist, getting a second opinion. But you want to make sure that you're comfortable with the steps that you're moving forward with your pet.
Excellent.
I will add one more thing to
Yes.
that. I think a very kind-hearted and sweet thing that many clients do is the kind of food is love situation. And
Doesn't always help
the most common question I get from my clients is my pet going to lose weight through treatment? And 90% of my patients gain weight through treatment. I will tell you that. They get extra spoiled. So, of course, we want to love on our pets every single day, and making sure that we cherish every single day with them. But we also want to make sure that
you're not adding insult to injury with overfeeding.
Yep.
That's a very good tip.
Yep.
If you could name your favorite pet product that you use for Ruby Tubbs or Blue Bear or Fletcher, Do you have one that you could recommend for the BCCB followers and the website?
That's really funny. So, you're gonna learn a lot of hidden fact knowledge about me, but during veterinary school, I don't know why, but I really liked dentistry.
Mm-hmm.
I always knew I wasn't gonna pursue it as a specialty, but I always thought it was really cool. So I was really good friends with my dentist all through veterinary school. Became really involved with Furback, and a lot about their dental products.
Yeah.
And so inevitably in my household, there's always some sort of CET chew in my household because I'm really bad. Sorry about brushing my dog's teeth. And so I try to use those for my pets, just because they're usually because they're the thin rawhide. They're not going to be the rawhide bones that you would worry about, potential GI issues with them, and then they also on top of it have the enzymatic activity for their teeth. So
Awesome.
that's probably my one go-to.
If you could live anywhere in the world and not have to work, where would that be?
Ah, man. So the first answer that comes to mind is kind of probably where my heart still lives, which is Austin, Texas. So that's what feels like home to me.
Mm-hmm.
That's where I went to college. That's where I have my closest family and friends still. I'm a huge Longhorns football fan, and so it'd be nice to be able to be closer home to them. And then also it's the live music capital of the world, so it's an easy answer.
Thought about your perfect life in 5 years. What would that look like?
I would be a brewmaster of a brewery named Ruby Tubbs.
Piano in a live band.
Yeah. Actually, no, it'd be called Hair of the Dog.
That's perfect.
But Ruby's face would be, of course, the logo. And I would be dabbling in Radonk on the side. And doing, I would do
plans.
Yeah, I would do, brewery physics calculations. That probably doesn't exist.
You
But,
just made that up.
Yeah.
Yeah. That's pretty cool.
But it was pretty cool. And then, on the side, I would be doing some radiation plans.
Awesome. Okay.
Yeah.
Well, thank you so much for doing this. You're a wealth of knowledge and inspiration. We really appreciate it.
Thanks, Courtney.
Yay!